In section 2, we're going to talk about clinician readiness, language matters, starting STI, identifying the targeted symptom, contracting, managing expectations, and one-session STI. Let's discuss clinician readiness now. I created this section because what I found is after doing trainings for nephrology social workers for the last couple years, I found that sometimes nephrology social workers were not using STI even after they had been taught how to use these interventions with their patients. And so I started trying to figure out why wouldn't they use these interventions. And I realized that sometimes there are internal barriers on the part of the social worker that prevent them from actually using these tools or interventions. So I'm going to be teaching you a lot of really cool interventions and tools that you can use, but it's not going to be of any use if you don't use these interventions. So I wanted to discuss this to kind of maximize how you can really help your patient and how you can use these tools. I also want to point out that interventions and tools are important, but you cannot overstate the importance of the sort of non-specific sort of clinical relationship between the social worker and the patient. It's really difficult to overstate the importance of the relationship because that's where the healing really takes place. So let's discuss some things that I want you guys to consider so that you can be more effective and compassionate with your patients. So why don't you consider these things before you start STI? I want you to consider how you take care of yourself. What is your self-care routine? And I say that because when you're in the helping profession and you're giving to patients, it's very difficult at times to give when you're feeling burnt out or you don't have anything to give. So it's really critical that as clinicians and medical professionals, we take care of ourselves. So I encourage you to sort of look at your self-care routine and figure out how you're taking care of yourself emotionally, physically, and spiritually so that you have more to give to your patients. That's the first thing. The second thing I want you to consider is what is your internal narrative? And by internal narrative, what I mean is what are you telling yourself? As you're going to learn soon, the way we think affects how we feel and it affects what we do. So in the past 2 years working with nephrology social workers, what I found is that sometimes people tell themselves, you know what, I'm not good at this kind of thing. I'm not good at these clinical interventions. And guess what? They don't do the clinical interventions. They avoid. When people are afraid, they avoid. So if you're telling yourself something like that, you're probably not going to use STI. So what I want you to do is to just be mindful of what you're telling yourself on a sort of moment-to-moment basis while you're at work, because your thoughts will affect how you feel and they'll affect what you do. The next thing I want you to sort of consider before you start STI with your patients is I want you to think about how do you feel about your patients? What are your thoughts about your patients? You and we all know that not all patients are easy to work with. And in fact, some patients are very difficult. And some patients really push our buttons. So what I want you to be aware of is before you go in to do a clinical intervention with a patient, I want you to ask yourself very briefly, how do you feel about this patient? What are your thoughts? Because if you're feeling judgmental, if you're feeling angry towards them for whatever reason, if you're not aware of it yourself, it will come out through your actions, okay? And it'll come out through your behaviors. So it doesn't matter how you feel or think. There's no right or wrong way. I just want you to be mindful of it, not to judge it, to just be aware of it so that you can compensate with it through your behaviors. So, because unconscious feelings really do affect our behaviors. So before you go in with a patient, kind of check in with yourself. Basically what you want to say is, what are you noticing right this second? Like, how do you think? What are you thinking about? How are you feeling? And what can you do right in that moment to kind of feel more centered and balanced so that basically you can help your patient as much as possible? Because the truth of the matter is that we communicate in 3 different ways. We communicate by the content of what we say, we communicate by the tone of our voice, and we communicate through nonverbal behaviors and body language. So we tend to focus on the content of what we're saying, but it's equally important how you're saying it and the tone of your voice. So if I go into a patient and I'm standing 15 feet away and I say, "Hi, Mr. Jones, how are you?" What does that convey? As opposed to going in and saying, "Hi, Mr. Jones, how are you?" Do you see, I'm saying the same thing, but the tone of voice and the body language is very different. And that's why it's really critical that you're aware of how you're feeling and thinking so that your interactions can be as healing as possible with the patient. The other thing I want you to know with language is that word choice is sort of important, especially around depression. And I found this because a lot of people have preconceived notions about what depression is. So if you ask a patient straight up, "Are you depressed?" a lot of times patients will say no, even though they are depressed, because they have their own ideas of what depression is. Maybe a patient is depressed, but they're mildly depressed. And for them, depression means you're inpatient, being inpatient or hospitalized in an inpatient setting, or you're attempting suicide. And so for them, it's a loaded definition. So a lot of times what I'll do is I'll sort of tailor my language to the patient. So sometimes I'll say, have you been kind of going through a difficult time? Have you been feeling blue? Are you kind of bummed out? Depending on the age and gender of the patient, I'll modify my language to match them. So I just want you to be mindful of word choice. Okay, starting STI. So now comes the good stuff. So you're working with a patient and you found out that they're going through a difficult time, and you found this out through either depression screener, through patient self-report, or through observation of their behavior. So you know they're struggling and they're going through a difficult time. And remember, there's no need to diagnose with STI. One question to consider is, does the patient want help with this problem? I've never had a patient say they don't want help with this problem, but it's something you want to clarify. So the patient is struggling and they do want help. The next step for you is to identify the targeted symptom. And the way that you do this is through a series of questions that begin with sort of general questions. I know you're going through a difficult time. Can you tell me more about that? They'll tell you something, you paraphrase down to, it sounds like you're struggling with X, Y, and Z. And then out of those things, what would you like to work on most? So we started with general questions, we narrowed it down, and finally we identified and we targeted the symptom. You're going to see me do this in these case vignettes that are coming up. So I would like you guys to see how I do this with Sam. Sam is a 75-year-old man who had a heart attack, and he is at home receiving home care services. The nurse referred him to the social worker because he's rarely getting out of bed. Here's Sam. Sam, the nurse is concerned about you. She said you don't get out of bed very much.
Well, that's true. I spend most of my time in bed just watching TV.
Can you tell me a little bit more about that?
Well, since the operation, I feel okay physically, but I don't feel like doing anything. I can get up and get a bite to eat, and then I just go back to bed and watch TV.
So even though you're feeling better physically, it sounds like you're pretty isolated, not doing a whole lot.
Yeah, it's true. I get phone calls I haven't returned because I don't feel like it.
Is that something you want to work on together?
I would like to. Yeah. I'd like to move on. I just don't know how to do it.
Is the isolation what's bothering you the most at this point?
I think so. Yeah. It bothers me the most.
Next, we have Sue. Sue is a 55-year-old woman who is back on chemotherapy after a reoccurrence of breast cancer. The nurse at the cancer clinic noticed that she's a lot more quiet and she's not really taking care of her hygiene, as you'll see in a minute. So let's take a look at Sue and see how I helped her identify the targeted symptom. Hi, Sue. I wanted to check in with you today. I was talking to the nurse and he mentioned that you're quieter than usual and he's a little worried about you. How have you been doing?
Well, I'm really not doing very well. I'm really tired all the time and I just can't seem to sleep. I'm not sleeping well, so maybe that's why. I'm quieter than usual.
Yeah. Could you tell me a little bit more about that?
Well, I just feel like I'm exhaustedly tired and I cannot fall asleep,
Are you physically uncomfortable?
No. Well, I have restless leg syndrome, but I take medicine for it. So it works pretty well,
Okay. Are you thinking a lot?
Well, yeah, I think a lot.
And what have you been thinking about?
Well, I'm just really worried about the cancer, and I wonder what's going to happen to me.
Yeah, that's difficult. Is that what's bothering you the most right now?
Yeah, I'm just really tired, and I can't get these thoughts out of my head.
Next, we have Jason. Jason is a 43-year-old man who has diabetes and who's very well known to the diabetic social worker, the social worker who works in the diabetes clinic. He's been a lot more irritable lately. So let's see how I help Jason to come up with the targeted symptom that we're going to work on. Here's Jason. Hi, Jason. How are things going? Not so well.
Yeah.
What's going on?
I don't know.
You a little more irritable lately?
Yeah.
Can you tell me more about that?
Well, I'm always angry. I don't know why. Everything pisses me off.
Yeah. It's a bad feeling, isn't it?
It really is, and I don't understand why I feel this way.
Is your irritability something you'd like to change, like to work on?
Yeah, but I just don't know how.
After you've identified the targeted patient, the conversation that you're going to want to have with your patient is the contracting conversation. And essentially what this conversation is you and the patient sort of verbally agreeing to resolve the symptom together. What you'll want to do is you'll want to express confidence that you can help this patient feel better, that you can put your heads together and actually work together to collaborate and resolve the symptom. That it might take a couple different interventions and it might take some different tools, but that you together can work and resolve this symptom. That is the contracting conversation. So let's see how I do that with our cases. Let's go back to Sam. Remember Sam was the older gentleman who'd had a heart attack and was, not getting out of bed and is really quite depressed. So why don't you watch how I contract with Sam to work on his targeted symptom. Here's Sam. So is the social isolation the thing that's bothering you the most at this point?
I think so. Yeah.
Is that something you want to work on together?
I'd like to.
Okay, great. Well, I have some ideas, and I have a feeling we can put our heads together and help you feel better, feel less isolated.
Okay. Yeah, I'm tired of this.
Okay.
I'd like to move on.
Okay. We'll work together. We'll figure it out. And the interesting part is once you start feeling less isolated, you'll probably start feeling better in other areas of your life as well.
Okay.
Let's go back to Sue. You guys remember Sue doesn't look so good. She clearly is struggling. So let's watch how I contract with Sue to work on her targeted symptom. Here's Sue. Sue, I know that you're really struggling with this, that you're having a hard time falling asleep because you keep thinking about, the cancer. Is that something that you want to work on together to try and get you sleeping better?
Oh, sure, that would be great, but I just don't know what to do. I do everything you're supposed to do. I sleep in a dark room. I don't sleep during the day. I don't take stimulants at night. Nothing seems to work. I'm just at a loss.
Okay. Well, you know what? I think if we work together, we can put our heads together and figure something out. I'm very confident that we can get you sleeping better. It might take a little bit of work on both of our parts, and we might have to try a couple different things, but we can get you sleeping better at night.
Okay. Okay.
And finally, Jason. Is the irritability something you'd like to change?
Yeah, I just don't know how.
I think if you and I work together, we can get you to feel quite a bit better and less irritable.
I guess. What do we do?
Well, I have some ideas. We're going to have a longer conversation. I'll offer some sort of suggestions, and I have, again, some thoughts and ideas, and we'll get you feeling better. And the interesting part is once you start feeling less irritable, everything will seem to get better. So now you've watched me identify the targeted symptom and contract with the patient to work on the targeted symptom. I want to talk about the next conversation, which is called managing expectations. But before we talk about that, I want to tell you about the ultimate goals of STI. The ultimate goals are basically threefold. Number one, the symptom improves, and as a result, the depressive episode improves. The patient starts feeling better. Number two, the patient learns some tools that they can use later on in case they ever go through a difficult time. So they learn these tools to prevent or minimize future problems. The third goal is that you, the clinician, is able to move on to help other patients. In order to do this, it's really important to sort of have a very brief conversation called managing expectations. And this conversation basically entails you explaining the parameters of your work together. You basically want to help the patient understand that you're going to work together to resolve the symptom and sort of improve the depressive episode or whatever difficult time they're going through, and help them understand that your time together will be very brief, it will be very focused, and it will be very time limited. Meaning when they start to feel better, you're going to move on and start helping other patients. So it's important for the patient to understand that this is what's going to happen. So why don't you guys watch me have the managing expectations conversations with Sam. Here it is. Okay, so here's what I'm thinking. What I'm thinking we'll do is we'll have a more in-depth conversation, and I'll ask you some questions about how things are going, and I'll explain some concepts to you and give you some assignments maybe for you to do at home. And then I'll come back in a week and see how you're doing. And as you start feeling better, our conversations will be less frequent. How does that sound to you?
It sounds okay. Yeah.
Okay. Do you have any questions about anything we covered?
Not at this point. I'd just like to get started.
And with Sue, watch how I help Sue in this conversation where we manage expectations. So, Sue, here's what I think we should do. I think what we should do is you and I should figure out a time. It could be now or in a week or so. And when you have like 25, 30 minutes, and we can talk a little bit more, and I could get some more specific information from you about your situation, and I can, teach you some things I know, and we can kind of figure this out, and I'll give you some kind of homework that you can do and assignments that you can do at home. And then, I'll meet up with you when you come back to the clinic, or I can, call you on the phone and see how you're doing. And when you start sleeping better and kind of feeling better in general, then our sessions will be less frequent. Do you have any questions about that? Does that sound good?
No, that's pretty clear. Do you think we can start now?
And finally, Jason. So what I want to do is spend about a half hour together, kind of talking more about this, getting a little more information so that I can understand, what's been going on with you. And I'll teach you a couple things and give you some suggestions and some assignments that you can do at home. And you and I'll meet together a few times over the next, 2-3 weeks. And as you start to feel better, my sessions with you, will be less frequent. I'll see you less often, but you'll be feeling much better.
Yeah, that sounds good. I really want help with this.
Now, I am imagining that some of you guys who work in hospitals in particular are asking yourself whether you can do STI, because you're looking at these various conversations between targeting the symptom and contracting and managing the expectations, and you're wondering, how could I do this? Because I might only see the patient one time. It is possible and beneficial to do STI in one session with a patient. And what you'll want to do is you'll want to identify the targeted symptom with the patient, and then you'll want to bypass the managing expectations and contracting conversations. You don't need those. And then you'll just follow and do some of the interventions that will be outlined later. But I want you just to know very briefly, and we'll talk about one session STI later on, but I want you to know right now that if you only see a patient once, it is possible and beneficial to do STI with the patients. You just don't need to do the managing expectations and the contracting conversations with the patient.